Well, I've mentioned in my last vlog that this is the year and now is the time to get tests that you need out of the way before prices climb in the coming year. Despite Bill Clinton's recent inference that healthcare costs have stabilized, and despite Ryan's promises that free market economics will stabilize or cut the costs of medical care, don't believe it. Your costs are going to climb. So I have said this before, get what tests you need now. Your insurance may cover it now and not when re-enrollment occurs. And if you have to pay for your lab tests, the costs will go up. So let's start with a test that I rarely see local primary care physicians ordering, and insurance companies will sometimes push back on paying for it. But the test is very important for assessing your heart health. In many ways, far more pertinent than those ridiculous calcium scans that cardiology and radiology groups frequently employ, and oftentimes they're just profit centers and they cost a lot of money. The test, it's called high sensitivity C-reactive protein, HSCRP. And here's what the Cleveland Clinic, maybe the best center for heart disease in America, says about the test. Inflammation or swelling of the arteries is a risk factor for cardiovascular disease. That makes sense, right? It has been linked to an increased risk of heart disease, heart attack, sudden death, stroke, and peripheral artery disease, meaning blockage of the arteries, for example, in your legs. It has also been linked to an increased risk of restenosis, reclosure of the artery that's been treated with angioplasty. If somebody has heart disease, you put something in through the artery, in through the vein, into the artery, trying to open up a blockage. Now, high sensitivity, it's also called ultra-sensitive. C-reactive protein is known as HSCRP, USCRP, or simply CRP. It's a protein found in the blood and what we call a marker for inflammation, meaning its presence indicates a heightened state of inflammation in the body. Inflammation is a normal response to many states, including fever, injury, and infection. But inflammation plays a role in the initiation and the progression of cardiovascular disease. Now, in studies involving large numbers of patients, CRP levels seem to be correlated with levels of cardiac risk. In fact, this is really important, okay? CRP seems to be at least as predictive of cardiac risk as cholesterol levels. And in one study, in the Harvard Women's Health Study, results of the CRP test were more accurate than cholesterol levels in predicting coronary problems. 12 different markers of inflammation were studied in healthy, postmenopausal, meaning after menopause women, and this was after 3 years, and CRP was the strongest predictor of risk. Women in the group with the highest CRP levels were more than, take a breath, 4 times as likely to have died from coronary artery disease or suffered a non-fatal heart attack or stroke. This group was also more likely to have required a cardiac procedure such as angioplasty or bypass surgery than women in the group with the lowest levels of CRP. Well, what am I going to tell you? I'm going to tell you that ordering the HSCRP is as important to me, actually possibly more important than taking a cholesterol level. I'm going to tell you about more tests in the future, so I want you to follow with these vlogs because it's important. This is Dr. Sam Benjamin with medical news you can use.